And so my job today is to awaken possibilities in others to restore teeth. Adhesive dentistry, what are the problems? We have post-op sensitivity generally, leakage, staining, recurrent decay, post-op pain on biting, chipping, and fracturing, and restorations fall off. Is there something that we can do? I would say yes, there is. And what it really is we need to learn adhesion and we need to learn how to do it right. So let's take a look at history because it goes back to 1986, fifth quarter seminars. So we would take one day off and attend that seminar. And this is where I heard about Dr. Fusuyama, the father of total etch, the first dent and bond in dentistry, and Ray Bertolotti's quest to bring Dr. Fusuyama to the forefront because he was being rejected by all of the great leaders of dentistry as almost considered heresy. And it was on that day and that first lecture and that it changed my entire career. I was always known for dental photography lecturing. I never lectured on adhesive dentistry. That didn't start until 2015 out of my, much against my own will. My intent was never to lecture to dentists. I am, like most of you, I'm a practicing clinician. The photography lecturing gave me a way to get my daughter around to different great spots in the world, and we traveled a lot with that. But then it turned into the adhesion side of it, and that was all new to me because that was not my intent. I need to touch on my mentors of the 80s and 90s. It started with Jim Dunn at Loma Linda University in 1983 when he taught me how to take photographs and all of us that wanted to, and he also introduced us to the world of adhesion. The next person that became a big part of my life was Ray Bertolotti. And this whole lecture will center quite a bit around my introduction to him. Other mentors were Dan Fisher, alumni of Loma Linda, president of Ultradan. It's like a dad to a lot of us. John Coyce, Frank Spears. In the early years, we heard these legends when they were lecturing on the main circuit. So you didn't really belong, you didn't have to go to their institutes. You could gain so much of the information at our big meetings. And then Dan Clementino, a friend of mine from 91 when he worked for Jay Morita, one of the most brilliant minds in adhesive dentistry as far as the chemistry, probably knows more than 99% of the dentists out there when it comes to the chemistry and the technical side of adhesion. What did we learn in 1986? We learned that you could etch dentin. Back then, that was not being done in the schools. We were protecting it with Di-Cal. We learned that you could bond a dentin. That was radical. We learned how not to stress the bonds. We learned that post-op sensitivity was history if you did your restorations right. So literally in 1986, the thought from that point forward of getting a tooth that was sensitive to bite, we knew exactly what the issue was from that point on. It was our adhesion and our shrinkage. We learned that you could basically bond anything with Panavia back in 87. And so what did we learn over those 14 years? Because I heard Ray consecutively from 1986 to 2000 in a way to write our trips off. And then we had our daughter in 2000 and it changed a little bit. But every summer, I'd learn something. I learned about deep margin elevations in Panavia in 1987. Now I have to clarify this. Ray wasn't teaching this. This was the deduction based on my brain when Ray would say, you know, we could bond amalgam with Panavia. And so we were coating our preps with Panavia, packing amalgam into it and having bonded amalgams. And I had this really deep amalgam that went way to bone. And I was able to get a double matrix, trim it, drive it down, and get it all sealed. And so I lined it with Panavia, wet Panavia, the way we would mix it, and then packed in the amalgam, let it set, and carved it up. And I called the chair of restorative at Loma Linda. I said, Doug, you've heard about this Panavia. I've got a perfect seal on this margin. It's bonded in with Panavia, but it's literally a bone level. Do I need to put a margin down there for my gold restoration? I don't think I do. And he goes, no, let the amalgam cure for a week or two and come back in and prep a gold onlay and put the bevel where you want it. And that, to my knowledge, is the first deep margin elevation that I know of. And it was done with amalgam in 1987 on a gold crown. From that on, I did them all the time. We didn't have a name for them. We just brought the margin to where we wanted it. And we did it with amalgam for a long, long time. And now we've gone. And then in 87, fragment attachments, dual cure flowables in 1990 with Bisfill, rib-on reinforcing in 91. IDS immediate end sealing was introduced in 92 for the first time. We could reduce the sensitivity in our crown preps when we had to prep a full coverage or replace a full coverage. Right before the impression, we'd do a media dense sealing. We would just put a coat of bond. We do our bonding procedure, cure it, and then we just quickly clean the margin and take our impressions. We could cement our crowns with zinc phosphate without feeling sensitivity for the patient. Most of the time we could do it without anesthesia. And then flowable StarFlow was introduced in 1996. Did adhesion work? Well, this is 1988. I was heavy into gold, and I had left Loma Linda, graduated, and I was taking place in a Tucker study club. And Tucker was doing gold a little different than we were doing it. So in 1988, we changed the design on our gold crown preps, and we no longer put retention in them. And Tucker Study Club didn't really like that. So I kind of drifted away from the club and just did my own thing. And these gold onlays were bonded on with Panavia with no retention. And the margins were brought up onto the occlusal incisal edges. And if you look at this one, these are more modern ones. And you'll hear about a calla lily later on, and you'll notice on these marginal, on the cusp tips, the gold is pulled right up to the cusp tip. You can actually still see some of the Panavia on the tooth there. But these are the restorations, 28 years. They're now 31 years old. There's a little breakdown at the margins, no question. But when you look at these on X-ray, you might think that they were done yesterday with a directed shrinkage technique or with many other different techniques. So those are now 31 years old, and there is no evidence of failure in those of any kind, other than some marginal integrity, a little breakdown, but no staining. And this is early 87 gray market of Panavia as well. We see a crack in a tooth. We didn't know all these principles other than, hey, we have a crack. We need to take care of it. We need to protect it and put the tooth in compression. So we would do these felspathic onlays and put them on with bonded Panavia and not prep that whole tooth away. And that again was felspathic. Then I was looking for some cases, and I didn't photograph because I never had an intent to lecture. And so I didn't document cases like a clinician would if they're in a university, but I found directed shrinkage. This is circa 1991. Ray had presented a paper at the Kahala Hilton using Bisfil 2B and the Paladent matrix, which was introduced in 91. And it was this new technique that was to stress reduce protocols. He talked a little bit about this in his lecture a month ago. And so when you look at the restorations, 20 years later, this could be a moment for discussion. Well, what do we do with these? They look a little beat up on the occlusal surface. Do we have tension joints in some of those areas where there's a degradation at the margin? Yeah, and it'd be fun to sit down with, Pascal and a group and just discuss how do you treatment plan this? What do you do? But what you do notice is no staining, no gross staining, no gross evidence of leakage. But then looking at this, you might diagnose this differently and say, well, we need to maybe replace this. But then when you look at the X-rays, of course, if we look at them really close, there's not a lot of stain. You don't see it, but you see some change in the composite margin. But when you look at the X-rays, do you see any evidence of leakage anywhere? And these are now, this was post-op taken in 21, and that now we're in 23. So we knew adhesion worked based on the evidence that we were seeing over the years.